This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our regular programming to bring you a special report, an update on the spread of COVID-19 in Erie County. We want to go live now to the studios of WQLN Public Media. Here's Erie County Executive Kathy Dahlkemper.
Good afternoon, everyone. Thank you for joining me today, and happy Earth Day. It's an unusual Earth Day for us, but let's all remember that today is Earth Day, the 50th anniversary of this day when we really look at our world and determine how we can leave it a better place. Today, here in Erie County, we have 4 new lab-confirmed cases of COVID-19 to report. One of these cases is in their 20s, 2 are in their 40s, and 1 is in their 50s. This brings us to a total of 62 lab-confirmed positives and 1,351 negatives. We also have 3 probables, which brings us to a total of 65. The Erie County Department of Health continues contact tracing and continues to communicate with the state about these cases. 3 of the new cases are in Zone 1 and 1 is in Zone 4, which can be found on the cumulative cases map by zone at eriecountypa.gov. We now have 35 recovered cases to date out of the 62 lab-confirmed total cases. So that means that we have 27 lab-confirmed active cases today. The age breakdown of our 62 lab-confirmed cases is as follows. 3% are ages 10 to 18. 11% are ages 19 to 24. 31% are ages 25 to 49. 34% ages 50 to 64. And 21% are 65 years or older. I will also share today the gender of our 62 cases. And we are split exactly down the middle. 31 women, 31 males, and that is out of the 62 lab-confirmed cases. Regarding race, unfortunately, my staff was unable to get me all of those numbers that we wanted to be able to get you today, and as soon as I have the figures on race, I will bring that forward to you. Again, the best practice for all of us is to act. Staff was unable to get me all of those numbers that we wanted to be able to get you today, and as soon as I have the figures on race, I will bring that forward to you. Again, the best practice for all of us is to act as if everyone we come in contact with has COVID-19. No matter the number of cases, we know that this virus is still out there looking for its next host. So let's continue to do our part to slow the spread of COVID-19 within Erie County. The state numbers today are 35,684 cases. The deaths are at 1,622. That is 1,156 new cases and 58 new deaths recorded in the Commonwealth within the past 24 hours. Crawford County has 17 positives. McKean has 5 positives. Warren County has 2. And as we said yesterday, they also have 1 death. The death in Warren County continues to be a mystery to us, and as of now, we do not believe that the person listed in the obituary in the Erie Times News passed away while living in Pennsylvania. We will continue to investigate this, though, but Erie County Department of Health has not had any recordings of deaths here of any of our residents. Chautauqua County still has 27 cases and 3 deaths, and Ashtabula County now has 70 cases and 6 deaths. Our enforcement team received 40 complaints yesterday, and they are following up on those calls, and they continue to make field visits throughout Erie County. I ask you again to please stay home. Continue to physically distance yourself at least 6 feet from anyone who does not live in your home with you. Continue to wash your hands regularly for at least 20 seconds, as well as sanitize and disinfect surfaces. And, as always, continue to wear your mask. If you need to leave home for work, for shopping, or even a walk, wear a mask. Your mask protects me, my mask protects you. In honor of Earth Day, I would like to discuss the proper care and disposal of masks. We recommend businesses protect their employees and customers by taking the following steps, but policies will need to be tailored for each business and each shift. So you could distribute 5 surgical masks, 5 paper bags to each employee, 1 mask for every day of the week for your protection from COVID-19. Prior to entering the building, all employees shall wear a surgical mask or equivalent, and that would include a homemade mask, a scarf, a bandana, anything that covers over their mouth and their face. The mask, as I said, must cover that nose and that mouth to avoid the spread of droplets, germs, and viruses, and may be removed during break and lunch periods as long as employees remain socially distanced from each other. At the end of the shift, the mask should be placed in a paper bag marked with number 1 with the employee's name. The next day worked, the employees should use mask number 2, and at the end of the shift, place that mask in a separate paper bag, this time labeled number 2, and so on throughout the week until all 5 masks have been used. On the 6th shift, employees will use, as they come back after the weekend, they would use the mask placed in the paper bag marked number 1, and the process would continue. And please do not place any more than 1 mask in a paper bag. And in the event a mask, of course, becomes damaged, employees should contact their immediate supervisor for a replacement. You are encouraged to refer to the guidance provided by the Pennsylvania Department of Health and the CDC, and this guidance and much more can be found under resources on the COVID-19 page at eriecountypa.gov. If you need information or assistance from the enforcement team, go to eriecountypa.gov or call us at 451-6700, or always email us at ecdhinfo@eriecountypa.gov. Finally, I would like to remind everyone to complete the 2020 census. The response for this week is 50% for the City of Erie and 57% for Erie County. So every Wednesday I will be reporting these numbers. Please complete the census. Encourage your family, friends, and neighbors to complete it when you are hosting your virtual host meetings with your family and friends. In case you didn't know, the U.S. Census Bureau is hiring, and you can apply online at 2020census.gov/jobs. The pay starts at $16 an hour. These positions are part-time and have flexible hours. So thank you for being with me today, and now I'm going to open it up to the media for questions. And today we will start with Erie News Now.
Good afternoon. A question for you regarding marinas, golf courses, that sort of thing. I've now seen some state representatives, maybe a state senator as well, urging Pennsylvania to open up golf courses and marinas, afraid that people will leave the state and head to Ohio or New York, where those businesses are open. Your thoughts on that, especially since Erie County is so close to both New York and Ohio?
Well, obviously it concerns me that people would be traveling to another state to play golf or to do those type of recreational activities. The state has decided at this point that our golf courses are closed. You know, I believe they will probably be on the early list of businesses that would reopen once the state decides we're going to allow other businesses to open up. But there will be changes. You know, there will be probably no clubhouses allowed to open. There will be cart restrictions, whether it be no carts or only 1 person per cart. And so I've seen in other states where the ball doesn't even go in the cup, that there's some kind of a membrane or something over the cup so that you don't have to even reach down and use your hand to pull the ball out of the cup. So those kind of changes will probably be coming, but obviously a concern that people would travel to those other areas and potentially then mix with people from another county who may be more susceptible because of the higher numbers in those counties. And that's really the concern itself. But being outside, we know, is a healthy thing for all of us. We're all looking for things to do to help us through this very difficult time. And so I'm hopeful that the state we'll decide when they start reopening things that golf courses could be one of those first things that do reopen.
Do you fear, though, that in the 2 to 3 weeks between now and then that the damage could be done? As the requirements there, the restrictions obviously are necessary, but is this one that, particularly for our county because of our geographic proximity to other states, could be actually doing more damage than good?
Well, I would request if anyone decides to do that, and I'm not recommending it at all because we do have a stay-at-home order, but that you always wear a mask wherever you go, that you wear a mask. But I'm not recommending that people go. It's actually been very cold. It's not been golf weather, so Mother Nature has been helping us with some of these things recently with the rain and the snow and the more March-like weather that we've been having here in April. And so I'm hoping that people understand that these restrictions are for a very short time of the period that people would mostly be golfing, and that they would think about that before they take off for another state to do those type of activities. Talk Erie?
Thanks.
Mm-hmm. Talk Erie, are you with me today? How about Jet TV?
Oh, here we go. I'm sorry.
Okay, sorry, Joel.
Mute.
Go ahead. Mm-hmm.
Sorry about that. Hey, I just along those lines of what Ethan was asking, was there any consultation with the counties when the governor decided to move the stay-at-home order from the 30th to the 8th? Again, we are in that competitive situation where you've got New York loosening up, you've got Ohio loosening up, and we're right in the middle here. And any connection at all on that decision-making process?
Those decisions are completely made in Harrisburg, and no, we were not consulted as to should we extend the stay-at-home order or not. That was just done as a blanket policy for the entire Commonwealth.
Is that something that you would wish that if there's other considerations that there would be some feedback loop from the counties?
I would like to be brought in on the loop on a number of decisions, but again, we're all doing the best we can in this time, and I know how busy we are in the county with all the work we're doing. I can't imagine how busy they are on the state level trying to help out 67 counties and the number of people that live in our Commonwealth. So, I'm hopeful that, again, my suggestion that we be looked at as a place, because of our low numbers, the northwestern corner has some of the lowest numbers in the whole state, that we could be looked at as a place that could hopefully prove that we could reopen maybe a little bit earlier than maybe some of the areas that are harder hit. Jet TV?
Thanks.
Mm-hmm.
Yeah, hi, it's Samir. I wanted to talk a little bit about the lawsuit now between the Erie County Police, the City of Erie Police Department and the County Health Department.
So it's between the FOP. It's not between the city and the county. It's between the FOP that represents the city and I think some of the county, but not all, because I know that some of the police chiefs and their membership are not involved in this within Erie County. So we've had multiple discussions weeks ago about how we could best keep our first responders, and I say all first responders, whether we're talking law enforcement, fire, those driving an ambulance and responding to people's needs, how we could keep all of those first responders safe. And we really kind of led the state in putting our addresses into our 911 system. And so anytime that a house that has a COVID positive individual in there, that would come up as a tag on that call, and our 911 call takers would be informing the first responder to that need for those respiratory precautions. We give orders for respiratory precautions sometimes when there is not a positive, but because of the nature of what the person has told us. But for those who are positive, we have those addresses in the 911 system, and we do believe that that is adequate. It provides two things. It gives that sense of security and knowledge to our first responder, but it also protects the person who's ill, who does have the ability to not have their identity revealed. And these are not criminals. These people have done nothing wrong except that they got very sick. So it's unfortunate that this lawsuit is going to now take public resources and time of my health department staff, who is extremely busy, are going to now have to be taken at some point into court to explain, why this is the best decision from the health department perspective, and that really is, according to the law, who gets to make these decisions at this particular time.
So then, at this point, the health department will not be releasing those names?
No, we've said that from the beginning. We're doing the addresses, and the addresses actually, I think, give a better coverage of protection, because we've talked about these probables, and let's just say Mary Smith and Joe Smith live in the house, and Mary Smith is the positive, so that's the name they have. But if Joe Smith is also in the house, you can expect that you should have to fully gear up and for COVID for both of them. And so it's the address rather than the person's name that we think really is the key piece of information to keep our first responders safest. Erie Times News.
Hi, Kathy. It's David. Want to talk a little bit, ask you a little bit about the enforcement for the masks. We've been getting calls specifically that some of the convenience stores in the city are not requiring masks of their customers. What have you been hearing from the enforcement, the task force, and how has compliance been, particularly in some of the convenience stores and some of those other types of businesses?
So I know that our task force has been reaching out to a number of our stores, and particularly those who are maybe part of a larger corporation. We're really trying to reach out locally, because sometimes some of these are not getting the kind of communication back from their corporate headquarters that we would want them to have had here in Erie County and from our standards. And our standards are very high when it comes to protecting people during this COVID pandemic. So we've been reaching out more locally and trying to work with our local store managers and help them to be compliant. All along through our enforcement division, this is not about being punitive. This is about being a partner and helping our businesses comply with this. So that's what we've been doing. And I'll reiterate what I said yesterday. One of our biggest concerns we're hearing from businesses is just the pushback that sometimes they're getting from those who come to their stores, and they don't want to have a confrontation with those people. So we really need our citizens to step up and wear the masks. And then, of course, we need everyone working in those stores. And that's what we're working with, is the stores, to make sure they understand their employees. Let's start right there. All of your employees need to have a mask on, and plus have their temperature taken, and all the other guidelines that have come forward from the state.
What I understand, Kathy, is the confusion comes from a sentence in the order where it says if you are in a business with medicine or food, you don't have to wear the customers don't have to wear masks, but the store has to make arrangements to deliver the items outside of the store. And from what I understand, this string of convenience store, it's Country Fair is what I'm hearing from, is that they are not following that. They're just not asking at some stores, not asking their customers to have masks. Is that what you understand, that that this chain is not understanding that sentence in the order correctly?
I don't know about the specific sentence, but I know that there's been some confusion about the order. And so, again, because we don't think that they're getting the direction that maybe they should be getting from corporate, we're trying to give the direction store by store, which is obviously a little more work for our people, but we're willing to do that and happy to do that. And we've had very good response from the managers. I think they really want to do the right thing too. No one wants to get sick in the store that's working there, and they don't want the people that are working there to get sick either. So that's our strategy now, is just to work store by store and to try to get them to understand the importance and to help them find ways that they can comply. Erie News Now.
Hi, what is the recommendation then for handling an unmasked customer? Should you stop them at the door and take a list from them? And especially because that can get confrontational. What is the recommendation to businesses if somebody is trying to get in without a mask? Should they have people posted at doors trying to keep an eye on that? What is the best way to go about enforcing this and keeping everyone safe?
I think the first thing is to start with signage, and to have signage up that's clearly visible for everyone coming in your store. If you're able to provide some masks, masks for people who want to come in your store but don't have a mask on them, then of course that helps to avoid any hard feelings from the person who needs to come in to get whatever they need. And we do have some, again, under our resources page, some guidance to help, and our at 451-6700, I have a trained staff who's really working closely with business owners to help them navigate that. But what we're going to need really is our people in this community to understand how important this is. And if we want to get not only these businesses to stay open and continue to serve you, but we want to get more businesses open, and you've already talked about golf courses and some of these other things, none of that is going to happen if we don't comply with this first guidance on the businesses that are already open. So for those people who continue to want to defy this, you're holding our community and the whole state really back on reopening because you're not willing to comply with this thing. It's going to be universal masking for months and months ahead, and it's a hard habit, but we're all going to have to get used to it. And I think what I'm seeing out there now is that the people who don't have masks on, other people are almost looking down on them because we know that their mask protects all of us. So we want everyone to be wearing a mask, but it is difficult, and I don't want anyone to get into a confrontation that would be dangerous for the employees, the business itself, and certainly not for anyone coming to visit that business. And so we don't recommend that anyone get into a confrontation that could be dangerous.
So would you walk me through that then? If, say, Joel wants to come into my store and he doesn't have a mask, what should I do there? If I'm a business owner and I've got someone looking to come in unmasked.
I think you should just, very matter of fact, tell them, I'm not sure if you're aware, but there is a, state mandate that everyone coming into any store needs to have a mask on. We have some signage up here, and we have a mask here for you, and I'm asking you to please take this mask and put it on while you're in our store. So I think as simple as that. Just try to, again, avoid confrontation, and hopefully, this first week's going to be the toughest week, to get people to really understand, and once they see more and more people wearing masks, I think this will become less of an issue.
Thanks.
Talk Erie?
Yes, Kathy, along that line, what are you hearing, what kinds of stories are you hearing from the stores and the other, open businesses about their access to these thermometers and to the masks and the other PPE that is being required by this order? Are they able to get access to that stuff?
I think it's really varied, and I don't have a lot of good detail to give you on that, and I'm hoping to have Karen Tobin, who's running our enforcement division, in here very shortly to speak on one of these press briefings with all of you, and she could give you a whole lot more detail about what they're hearing and what they're seeing out there. But I think some businesses were prepared, they were ready, they maybe had better sources for some of these things, others are still struggling. And so that's why we also, on the enforcement side, are trying to be a little more lenient and certainly trying to be a partner as much as we can here, particularly in the beginning, as everybody tries to get used to this new normal and figures out a way that they can implement that. You certainly can't expect everyone to take a temperature of everyone coming in if they can't even get one of those thermometers, one of those infrared thermometers. It may be ordered, but it may be another week or 2 or 3 even before it comes. So what we have suggested is that you ask your employees to take their temperature before they leave their home, and then come in and report to you, what their fever or not was that morning. So that's not the best solution, but until we all have the equipment that is needed, that's the best we could come up with. So we all know that this mandate from the state came down on Wednesday, so it was a week ago today, and it went to enforcement on Sunday, but that wasn't many days for businesses to be able to get all of the equipment that they would need and the masks that they would need. So we know that there has to be some leniency here, but for the most part, businesses truly are trying to comply with this. Jet TV?
Real quick follow-up.
Okay, sure.
If I could grab a follow-up real quick. We are getting reports that members of the federal government, employees of the federal government, are not restricted by this mask order. Is that accurate? I mean, we're actually hearing that their supervisors are saying that the temperature check and the mask are not required for federal employees.
Well, I read that the federal courts are mandating masks, but, you know, government entities are their own. State government can't tell federal government what to do. And so hence probably where you might be hearing some of that. But as far as I know, the federal government entities within Erie County are complying, but I don't really have good information on that, but I will see what I can find out for you.
Thanks.
Jet TV?
Yeah. Do you have any information regarding, I guess, ventilators in Erie County? Do we know if any of our cases are currently on ventilators, any of them hospitalized?
I do not, but tomorrow our healthcare partners will all be with us, so that would be a good time to bring up that question to UPMC, Allegheny Health Network, and LECOM, as well as the Veterans Administration Hospital, who will all be with us tomorrow as they are on Thursdays.
And then just to break away a little bit from that, I know we received an email from a viewer regarding the Rite Aid testing, so maybe this is also another question for the health providers. But I guess what is the county's take on Rite Aid holding their own testing site there, where it's like self-tested?
So our biggest concern, I mean, it's not a bad thing that they've opened up a testing site, you know. It's overseen by a pharmacist, and I haven't been up there yet to see exactly how it's done. I think today might be the first day. So the concern, I mean, I think some of us have seen people being swabbed on, you know, TV or other media sources, and it's a fairly high up in the nasal passage swab, and it's a bit uncomfortable. So will people do that to themselves? Will they get a good enough swab is our biggest concern, and could we have some false negatives because of that? So that's our concern. Time will tell on that.
So then if people aren't properly administering this test, isn't that kind of a waste of a test kit there?
Well, it's being overseen by a pharmacist, and we don't have any data yet, so we're hopeful that the pharmacist is making sure that the swabbing is done in a proper way and done adequately to get a good sample. So we have to rely on our healthcare providers to make sure these things are being done. Again, you can't just drive up there and show up. You know, you have to have a reason to take the test. You have to be having some symptoms, and so it's not open to anyone who just wants to randomly find out if they have COVID-19. Erie Times News?
Yes, Kathy, just wanted to touch back with you again on the two long-term care facility cases of COVID-19. Were you able to find out any more information on them?
So we do have two individuals who are residents of longer-term care facilities, and they are in two separate facilities.
We know the first one you had said was a transfer. Was the other one a transfer as well, or was that a resident, you know?
I believe it's not a transfer. I believe it's a resident, yes.
Okay, so one is a transfer, one was already a resident. Okay. Are you able to name the facilities at this point?
No, I would not do that. Just like I wouldn't give out addresses of people's homes during this briefing. You know, we have them, as I said, in the 911 center, and those facilities would also be listed in our 911 center for addresses of positive cases. And you know, we're not going to give out the specific addresses or names of where a person who's positive is located to the general public, just to our first responders. Erie News Now?
Hi, with the 4 new cases today, any success in tracking down where those people may have come into contact with the disease? I realize it's still incredibly early in that process, but then also, of the other cases, any clue roughly how many appear to be community spread where we just can't seem to figure out where they came into contact with it?
I don't have those figures with me today. I don't really know. I heard that one of the cases we had today definitely is a contact, a very close contact to a previous case. And I know they were doing 4 cases, so there's a lot of work today to do all that contact tracing. But I'll try tomorrow to have some better information for you on, you know, of our 62 lab tested confirmed cases. I'll try to get a better idea of maybe how many we really haven't been able to find a direct contact or a travel related. And obviously right now we're having very, very few travel related, because most people have just stopped traveling, and that's obviously a great thing. Doc Erie, do you have any last questions?
Just a quick one about the prison releases. What is the protocol? Is there any official guidance from the prison system to law enforcement to kind of keep an eye on these early releases? Can you give us a little bit of deeper data on that?
So first of all, it's important for people to know that the prison cannot release people. The releases are done through the court system. We can't just decide in Erie County Jail that, you know, we want to reduce our numbers and we're going to release people if they fall under certain criteria. So every released prisoner, early release I should say, has been done through a court system, and that has been the work of our Erie County courts, along with our judges, as well as probation officers, as well as the public defender's office, and then working obviously in conjunction with the jail. But these people who have been released, my understanding is many of them were close to being released at one point. They have more minor infractions. These are not people who have committed heinous crimes or crimes that would put people's lives at danger. So sometimes these people haven't paid their child support. They may be more crimes that are related to addiction issues and mental illness and those type of things. So we know that it's a good thing to get more prisoners out of jail right now with COVID-19. Our prison numbers are down to 441. That's 200 or more less than we normally have there. And as we talk about social distancing, this is really key. If we would get a case, we do not have any cases of COVID-19 in our jail, but we know that many other counties do. And in fact, I think I heard on the news yesterday that that Crawford County may have a case. So it's a huge concern when you have people living in a congregate setting like that of a jail. And so getting those people out of there that are not a danger to society has really been key as we try to deal with this pandemic. So I feel very grateful to the court systems, the public defender, and all those involved with these individuals that we are able to. Many people are monitored outside of the jail by the probation team and others. So that's happening. It's just in greater numbers than normal.
Thanks.
Jet TV?
Just one final question. How is the mask program going that the county kind of asked organizations or nonprofits around here, like Serve Erie, to help make masks? How's that going, and where can residents pick up or find them?
Well, I maybe can come back with some more information about that. We are bringing in the Medical Reserve Corps to help us with the mask project, and so masks are being made, and then the Medical Reserve Corps will package them up in a plastic bag, so they're going to be laundering them first, of course using gloves, very sterile conditions, and then putting that mask in a plastic bag for distribution. So that is just kind of getting ramped up and going. And so once we have more information on maybe where those can be obtained, I can get back to you on that. And Erie Times News? Do you have any final questions?
Yes, Kathy. I just want you to, if you can, we talked about the convenience stores, some of them not following the guidelines. But overall, how has compliance been since Sunday night with customers and people working, employees working, wearing masks overall? What has the task force told you? Has compliance been good overall?
So we are pleased with the compliance. You know, it's always can be better, I think, but for the first few days, we are actually very pleased with the number of businesses that really want to do the right thing or trying to do the right thing, maybe struggling because, as was mentioned, they don't always have all of the equipment and gear that they need, masks and thermometers and things like that, but that they are really trying hard. And I think the businesses understand that are open right now that they are the test case. You know, they are the ones who are leading the way for the rest of us and for all those businesses that are closed. And so we really appreciate their partnership in this, and we are not seeing a lot of huge concerns out there. And you know, we'll be doing spot checking, and we'll be observing and going out, you know, and doing just kind of an observation of businesses too, and they may not even know that an enforcement person is there. but we think that is a good way to really kind of see what is happening at that business when there is no one there that they know is an enforcement person, and then we can go back out if we need to with the full enforcement team. But we will be doing those kind of checks. And really, we're trying to call businesses first. We don't want to be looked at as Big Brother or anything like that. We want to be your partner. We want to help you comply, and we want to make sure that you're staying safe and all your employees are, as well as everybody coming into your business. So that's really what we're about, is being your partner in complying with the mandate that's come down from the state. That's really an important mandate that's going to keep all of us safer.
And then one just quick follow-up. I had a question about some confusion on whether common areas in apartment buildings are considered a place where masks must be worn. Do you know that specific circumstance, and can you speak on that?
First, I've had this question, but I would say yes, because it's not your home. So anytime you walk out of your apartment, wear a mask. If you are out in a place where there's other people, you should have a mask on. Now, if you're sitting in this common area and you're just all by yourself, I still would say wear a mask, because what you're breathing, if you're speaking, you could be on your phone talking, all those droplets come out, could get on the furniture that you're sitting on and in that common area. The one time when I don't think it's as necessary to be wearing a mask when you're out is when you're on a walk or a jog and there's no one else around you. But I try to carry my mask with me, and then when I see people coming towards me or coming beside me, then I flip on my mask so that I have it on when I am anywhere near that person. But often I'm walking and then I don't see another person in sight. I don't have to have the mask on during that time because I'm outside, and so the chances of any COVID-19 droplets getting onto any surface that someone else is going to touch is very, 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 very small. But when you're in a contained space such as a common living area, maybe a rec room type situation in an apartment building, I would say definitely you should be wearing a mask. And that would be working out. If your apartment building has a workout room, you should definitely be wearing a mask, because when you're working out, your droplets out of your nose and your mouth actually can go farther because of the heavy breathing from your workout, just like when you're singing. And so definitely be wearing a mask when you're in those type of common spaces in an apartment building. So good questions, interesting questions, lots to continue to talk about, but this community is still doing great. We are working hard together to keep our numbers down. I cannot thank all of our partners enough, and our partners are mostly you, the people of Erie County. So continue to help us stay in a good place here in Erie County. 62 cases, but well over half of those people have already recovered, and 27 still recovering, and we hope that they all have a full recovery. So in the meantime, I ask you to please wear your mask, wash your hands frequently, don't touch your face or your eyes until you have washed your hands frequently, clean surfaces, stay physically distant from other people, a minimum of 6 feet. If we do all of those different things, we'll continue to have good results here in Erie County. So in the meantime, please stay home, please stay safe, and please stay calm. Thank you.
All right, you've been watching today's update on COVID-19 from Erie County Executive Kathy Dahlkemper. In case you jumped in midstream, so to speak, here are some of the headlines from today's update. The county executive revealing that there are 4 new, what they're now categorizing as lab-confirmed positives. That takes us up to 62 in Erie County. She also broke it down this way. One of the new cases is someone in their 20s. There are 2 in their 40s, 1 in their 50s. 3 of the new cases are from zone number 1 on that county map that we've been showing you for the past couple of weeks now. Zone number 1 is the city of Erie. 1 of the new cases coming from zone number 4. That's primarily western and southwestern Erie County. She also gave us a bit more of a demographic look, at least where gender is concerned. And with those 62 lab-confirmed cases, Kathy Dahlkemper said we are split right down the middle, 50-50, 31 women, 31 men. We do want to let you know that you may have noticed this afternoon that Governor Tom Wolf and Dr. Rachel Levine did not hold their normal update at 2 o'clock in the afternoon. They are planning, or the governor is planning, to address the Commonwealth at 7 o'clock tonight. Now, in place of our regular Facebook Live update tonight at 7 o'clock, you can see the governor's address. We'll stream it on our Facebook, also on YourErie.com. You can also watch the governor, of course, live right here on Jet 24 and on Fox 66. All right, let's break down the numbers a little bit more. Confirmed cases of coronavirus near us. Right now, as I told you, a total of 62 confirmed cases in Erie County. Now, that's according to the state's website. Also, 3 probable cases. Crawford County now has 17 cases. Warren County reporting 2 cases and 1 death, although there are some questions about that 1 death. There are 27 confirmed cases reported in Chautauqua County, New York, 3 deaths there. 78 cases in Ashtabula County, Ohio. That number jumping up by 10 in the past day, with 6 deaths there. State Department of Health releasing the latest updated numbers for the Commonwealth as a whole. As of today, 1,156 new cases of COVID-19. That brings the state's total to 35,684. The number of deaths right now at 1,622. That's up 58 in the past 24 hours. But the negatives, as far as people tested, now over 136,000 people. So the best advice, as always, to stay safe is to stay calm, stay home, wash your face, practice social distancing, and wear a mask. Jet 24 carries a live digital exclusive coronavirus newscast 3 times a day, every day, 11:30, 3 and 9 on our website, YourErie.com. It's also on the Your Erie To Go app. We'll have a complete wrap-up tonight on Jet 24 at 5 o'clock. We'll also have that update from Governor Wolf beginning at 7 o'clock from the state. Thank you for joining us. We'll see you at 5. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to YourErie.com. We now return you to your regularly scheduled program.